Hi, Sam.
Hi.
Thanks ever so much for agreeing to this interview. Can we start by asking you to introduce yourself, please?
Yeah, of course. I'm Samantha Glover, and I am the new Chief Executive Officer at Healthwatch Essex. Currently in my third week in this new role, so enjoying the new challenges.
And of course, you were the former chair of the.
Yeah. So I've been involved with Healthwatch Essex since its inception. Helped sort of launch the Healthwatch brand back in 2013. And was on the Pathfinder format for setting up the Health Watches. So I've been involved as a volunteer in roles as a director, as a trustee, as vice chairman, and then chairman. And the opportunity arose to apply for this role, which was a very strange process because it happened over lockdown. I had a couple of Zoom interviews and then a face-to-face interview, and was appointed at the beginning of August.
And that was great news, by the way. So congratulations. I've got 4 questions for you, and the first one is one I normally ask, and it's about how you're looking after yourself, and also how you're supporting your team. And I know that whilst you've been in the post for 3 weeks, you were actually an interim CEO. Well, you were supporting as the chair, whilst you didn't have a CEO in the organisation.
Yeah. So we had that kind of double-edged sword of going into lockdown and being without some of our leadership structure. So what we did very, very early on was put an interim structure in place so that we had somebody to support the day-to-day functions of the office and the management. We had somebody that focused on our outputs and quality, someone else that was supporting projects. And then the most vital role was somebody who just looked after well-being. So they had a weekly conversation with every member of the team, not focused on where are you with your projects or your timelines, but on how are you? How are you coping with lockdown? How are you looking after yourself? How are you feeling? And that, I think, has been vital to the team throughout. And as we've progressed over the months, different members of the team have continued with those weekly. Some of them have dropped down to bi-monthly or monthly conversations, but they know that their direct route is there. And that member of staff is particularly good at this kind of conversation and making sure people do feel okay and putting support in if they don't. We made sure that all of our volunteers, trustees, board members and staff knew how to access services from Mind if they felt that they needed a little bit more additional support or professional support. And we did all we could to encourage that flexible working. We've got some members of staff who are at home with children and had childcare commitments. So it was very much about having those open and honest conversations about what you can do and what you're finding challenging, and rather than focusing on the can't, look at what people can do. And I'm really pleased to say that actually we looked after one another. They're a great, small, perfectly formed team, so they were able to do that. And projects haven't slipped. Our productivity has remained high. We've just looked at different ways of engaging our community. Those face-to-face meetings are now taking place as Zoom or Teams calls. We have a forum of people with different disabilities, and the facilitator of that just took to ringing everybody up once a week just to check that they were okay, and putting them in touch with our information and signposting service if they needed, a little bit of extra stimuli or wanted to dial into some other support. So they've been kind of looking after each other and using that structure. We knew that our information and signposting was going to be a priority internally and externally, so we made sure that they were able to access the information. People were still able to contact those even though we weren't in the office. And then from a personal perspective, I was trying to juggle 2 jobs for a little while. So I set myself and I booked it in my diary every morning to do my yoga practice, just so I could start the day by calming myself down, having a plan of what I needed to get done during that day, and just taking that half an hour to myself. And I think that's been really useful. I didn't realise what a hugger I am, and not being able to hug people for months now has been a bit of a challenge. So I've taken to booking in a phone call every night with a different friend or a different member of the family, just so I feel that I'm still connected with people, even though I can't touch them.
Yes, that is really difficult, and I've got a couple of members of staff who live on their own, and that's been, that really that's tough, isn't it? And your focus on well-being as the priority is absolutely brilliant, because if you can look after yourself as far as you can, the work will come, and you're still in the mindset of being able to do that. That's fantastic to hear. What do you see as the role of Healthwatch during the pandemic? You've touched a little bit on signposting, for example.
Yeah, so I think that signposting has remained a really important role that we carry out throughout this, making sure that people are still connected. Even if they can't go to their normal clubs, there are still an awful lot of services operating in a different way. So that's been a vital role that we've made sure has been carried on throughout. But I think the most important role for Healthwatch is hearing those voices that are not being heard elsewhere in the system. So those people who are stuck at home and not able to go out and are having challenges accessing the services they normally would, it's engaging with them in a different way. This has been incredibly difficult for people with sensory impairment, especially, not being able to see the one-way signs on the floor, and being abused by members of the public because they aren't following the rules. People trying to access a GP that's no longer open and can't use a phone service because they're hard of hearing, and then presenting at the GP to be confronted with an intercom. We're just trying to make sure that we support them, that we hear the voices of those people that are flourishing and those people that are struggling, and learning from both of those. One of the pieces of work that we've been doing throughout the pandemic that I'm particularly pleased with is our COVID diaries. So this was short films from a range of different people to just get a snapshot of what their life is like during lockdown. And I think there's going to be some great learning that comes out of those. Our Collaborative Essex Forum that I spoke about earlier, which is 15 individuals with a range of different abilities and disabilities, learning from them about what life has been like, but making sure that we hear that voice throughout. The other role that we have been playing during this time is making sure that we reshare information. So our communications team are gathering all the information that comes down from government and putting it in a really tangible way and sharing it on all of our social networks so that people have got that information in a way that is understandable. We've been resharing other people's surveys as well as carrying our own out, so we can look at the services that we provide. I think the other important thing that we've done is a bit of work around digital literacy. So as the world is changing and we're becoming a little bit more online, we need to work out whether that's accessible for everybody. So we've done a piece of work around the challenges that people are facing with digital literacy, what works for them, and what they've found difficult.
It's not me that does the invoice.
Now that the last bit is really important, because as we both know, the health and care system is really moving at pace into a world where it could become the dominating factor in how people access service. My third question is this: how do you use the user voice you capture? You've given an example of the diaries.
Mm-hmm. I think at Healthwatch Essex, as with Suffolk, we're kind of a centre of excellence for co-production. So what we learn, we share. We don't hold on to those stories. We're the custodians of them, but we share them as broadly and widely as we can to affect positive change. So, for example, the piece of work we've done around digital literacy, we've made sure that all our STP and ICS partners are aware of that. So they know the challenges when they're planning their services moving forward. They've got that information, so they know that these programs work better, that if you're sending information out to people that use screenwriters, they can't have it in boxes because the screen readers won't work. And so we're making sure that when we gather that view, that voice, that we share it, and just trying to make people aware of what it's like for somebody else. And I think the COVID diaries again are a great example of that. They're sort of things that you might not think about, not because you're trying to be difficult, just because they wouldn't be something you think about, and it just helps to share what life is like from other people's perspective. What we do throughout everything at Healthwatch Essex is ensure that user voice is at the heart of every decision that's made about health and social care in Essex, and the pandemic hasn't changed that. We've just had to look at different ways of making sure that voice gets to the people making those decisions.
Yeah, absolutely. The intelligence that you carry doesn't sit on a shelf somewhere in a nice wrapped up book, does it? And you're also a very trusted resource and a partner to the networks that you've got across Essex. And in fact, Essex is quite unique in that you've got 3 sustainability and transformation partnerships across your patch, which is quite a load to try and manage and be a part of. My last question is about looking to the future. So what learning and challenges actually do you think will come from the outbreak?
I think there are a few big challenges. I think because of having to firefight in this time, our NHS staff, our care staff are on the edge of burnout. They've been working incredibly hard for a very long period of time now. So I have a concern around that, at a point where their waiting lists are probably longer than they've ever been, because people's operations have had to be moved, postponed, cancelled because of COVID. We've had to divert services away from prevention and preventative medicine, because we've been focusing on people in a more acute situation. So we've had to shift that. And whenever you shift something upstream, there's always an effect downstream at a later point. So I think we're on the edge of a concern there. And I think we are probably on the brink of a mental health pandemic now. We've got children who have been off school for months on end, who are going to be racked with anxiety going back to school, and how we support them families around that decision, how we support people who've been working from home, going back into a wider workplace, back into the community, and looking after their well-being and mental health throughout that, I think is going to be a concern. But there's also some real learning opportunities that have come out of this. And we touched on this earlier, but I think technology is definitely going to be something that's going to have a huge positive impact on the way we operate in health and social care. I think the pathways that have been created have been really sensible. So direct routes to care, I think that's something we definitely need to look at. And I think this has brought people together to work in collaboration. Co-production is something you and I talk about all the time, Andy, but I think it's really helped people see that if we work together with a set focus, we can achieve a great amount in a short period of time. So they're things I would like to see take forward. But more than anything, what this has taught me, and hopefully the community, is we need each other. And when we support each other is when everything gets better. And that there's so many examples of this. The army of volunteers that came forward, the kindness campaigns, the clapping for carers. That's what we need to hold on to.
Absolutely, you captured a lot there. I wouldn't be able to add to any of that. That's a really good snapshot of what the future could look like and should look like. Sam, thank you very much for your time today.
Thank you, Andy.